Thanks for joining us on another episode of Health Options, the program that not only tracks government policies on health, but provides you with the information you need to make the right choices about your health. Welcome to the program. I am Rabi Abdullah. Do you know what or where your microbiome is? This is truly one of the most exciting frontiers in medicine, often referred to as our second brain. The microbiome influences many areas of our life, yet most people remain uninformed about it. The microbiome is the complex ecosystem of the digestive tract, where billions of invisible bacteria live together and help keep you healthy and happy. You must not miss out on our Nature Scanner, as you will get more enlightenment on the topic for your health benefits. The attainment of polio virus-free status by Nigeria is historic and remarkable, not only for the country, but the entire continent of Africa, an achievement that has shortened the distance in the race to a polio-free world. Now that the country has overcome the wild polio virus, what needs to be done to keep it at zero level on a sustainable basis? Answers to these and more as we evaluate Nigeria's wild polio success story and other issues revolving around child survival on this episode of Health Options with the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency, Dr. Faisal Shaib, as my guest. You'll get to meet him shortly. This is Health Options, and we're taking a look at Nigeria's wild polio-free status. And joining me in the studio to take us through the discussion is the Executive Director and Chief Executive Officer, National Primary Healthcare Development Agency, Dr. Faisal Shaib. Thanks for joining us on Health Options, Doctor.
Thank you for having me.
Okay, let me start by congratulating you. I'm congratulating all of us as Nigerians, particularly you. The front runners, those who had really pushed, this journey to where we got to today. Congratulations.
Yeah, thank you very much, Ravi. It's an incredible journey that we're really glad that we've crossed the finish line.
Well, so, I don't know, there's something I want you to share with us. While the clock was ticking to the destination, what was that critical moment that were like, apprehensive? Oh my God, are we going to get there or not this time around?
Right, I think it will have to be way back in 2016 when we had the reports of wild polio viruses in Borno State. So we had gone almost 2 years without any reports of wild polio viruses in Nigeria, and we erroneously thought that we had actually stopped transmission of wild polio viruses. But of course, when further surveillance was done in those areas that were previously inaccessible due to the insurgency, we now got samples from those local government areas, and lo and behold, we had 4 wild polio viruses. And at that point, the general impression was that, oh, not again, because we thought we had actually finished. Even WHO, celebrated with us, deemed us free of wild polio virus at that point. But of course, that was not the case, because when we did genetic sequencing, that is to understand where the viruses were coming from, we realized that they were actually indigenous viruses. They were not imported. Since they were indigenous, what it means is that we never interrupted. So at that point, we were really, really cautious, and we were concerned about, how we're going to do it. But this was, again, the same time that Mr. President Muhammadu Buhari stepped up, provided leadership, and not only provided the funding to support that outbreak response, but he also showed statesmanship by rallying the troops and rallying all Nigerians to a common cause. He showed statesmanship by making sure that he vaccinated his kids, his grandkids rather, and then other statesmen, governors took part in vaccinating their kids, traditional leaders, So from a situation where people were a little bit apprehensive, there were sections of, especially northern Nigeria, that were skeptical about oral polio vaccine. In terms of sustaining what we've achieved, right? We are using polio resources to help with the fight against COVID-19, and you can see how it appears we're winning that battle. But beyond that, we've also used the same lessons from polio eradication around how you can use data to predict where infections will take place, whether these infections are measles infections, meningitis infections, how we've been able to use GIS technology to be able to map communities, moving away from hand-drawn maps to maps that are high resolution, where you can really say this is where people live, and you can get teams to go to those communities and make sure that everybody is vaccinated. But even beyond the vaccinations, how you can give a package of health services. So maybe in the 90s, we started off by giving only oral polio vaccines. But what we have also learned is that community members don't want only oral polio vaccines. People also want treatment for malaria, people want treatment for pneumonia, people want treatment for nutritional challenges. So when we go to the communities now, we go with health camps that give a package of services. So this is how we've been able to also get community members to bring their children for routine immunization services. So we're at the point where between 2017 and 2019, a short span of 2 years, 2.5 years between when we did a mixed NIC survey, a survey to find out how well vaccinated our children are, done in 2016, 2017, and what we did in 2019. From 33%, we've been able to more than double it to 71%.
Wow. So
impressive, right?
Yeah. Would that boost in our immunization coverage? I know that insecurity is still an issue, and is there anything new that is being done in that regard, coupled with the fact that we're in a pandemic? And I was made to understand that had kind of affected service delivery. Talking about routine immunization now, it's really a source of concern, because I know even the WHO had raised an alarm in that regard. What are we doing for us not to be caught napping?
Right, so it's all part of how we are leveraging on the polio eradication lessons to strengthen routine immunization. In the last few months, because of COVID-19, you're absolutely right, WHO and even the Federal Ministry of Health and MPHCDA drew attention to the fact that because we had the lockdowns, right, people could not access the primary healthcare centers, secondary and tertiary healthcare centers. Because of the lockdown as well, movement was difficult, right? But over and beyond that as well, you had people were concerned about the potential for them to contract COVID-19 if they went to the health facilities. And so that had a huge impact in causing a dip in access to primary healthcare services, in fact, all services. So what we have seen is that, first and foremost, what we did was to send out a public service announcement, right? I'm sure NTA also was part of the media blitz around, people can still go to health facilities even with the COVID-19, right? We had those public service announcements, but we also used our community leaders, traditional leaders, religious leaders, to actually communicate very clearly about what the risks are for contracting COVID-19. We trained over 200,000 primary healthcare workers on how they can do a better job of attending to their clients. So what we have now seen is, after that initial dip, services are now beginning to climb up. Routine immunization services are beginning to improve. Women are now going back to the health facilities for antenatal care. So there's more confidence coming back into the system. Even the health workers that originally were concerned about their own safety, because now they understand that if they have their face masks, if they sanitize or wash their hands, and if they practice social distancing, that they'll be able to safeguard themselves and the health of their clients. Same thing, clients have understood that, COVID-19 is not a death sentence, right? So if you are able to manage it wisely and follow the guidelines of the NCDC and the Presidential Task Force, that, you're going to be fine, right? So because of that, we're now beginning to see these health workers are managing their clients very well, and the attenders of primary healthcare facilities are getting better.
Do we have any vaccine stock out on any of the childhood killer diseases? Polio, it's out. So we still have others, measles, I still came across a publication on, the number of Nigerian children that are at the risk of, getting infected with measles, and I got worried. Have you seen that publication?
Absolutely not. We've not experienced any stockout in vaccines since 2013 because we now have a robust and very comprehensive supply chain that makes sure that the vaccines arrive on time and they get to the health facilities in good time. Yes, because of the dip in routine immunization following the COVID-19 outbreak, what it means is that women could not take their kids for their shots, right? Because they could not do that, that makes the kids be at risk. It makes them vulnerable to measles and other vaccine-preventable diseases. But we are optimistic that now that the restrictions, the lockdown restrictions are being lifted, then people are going back to the health facilities. Women are taking their kids now for vaccines. So we anticipate that vulnerability will decrease, along with all of the massive efforts that community and frontline workers are putting in to make sure that we not only sustain the improvement in routine immunization, but that we even surpass our expectations. The expectation was that we will get to 85% by 2028. That was the projection from 2017. But given that we've more than doubled it within 2.5 to 3 years, we're optimistic that maybe in the next 2 to 3 years, we'll be approaching 85%. So all of this work has come as a result of the close partnership with our development partners, with donors such as the Bill and Melinda Gates Foundation, with Aliko Dangote Foundation, our development partners, our traditional leaders, right, led by the Sultan of Sokoto and under the chairmanship of the Emir of Argungu, So working together with all of these critical stakeholders, making sure that we keep our eyes on the ball. The Nigeria Governors Forum, the governors, have been through a peer review system, been very, very active. Unlike maybe 10, 20 years ago, you now have a situation whereby governors are providing leadership, making the resources available, and we continue to advocate also to the National Assembly. So we're at a point where there is a confluence of Nigerians in identifying what needs to happen, how we can improve the productivity of all Nigerians by making sure that they are healthy, that kids get the vaccines that they need so that they can live more productive and healthier lives.
Still in this pandemic of COVID-19, and has there been any form of modification? Because I know that such structure is still equally being deployed, just like it was used to address Ebola.
I've had the honor and the privilege and, the unique, luck of being part of this journey right from, the early 2010s, 2011, where we established the Polio Emergency Operation Centers, and because of the experience we had running them, we were deployed to the Ebola front lines. We used that partnership, the leadership provided by the Minister of Health, the governors, all stakeholders to stop Ebola in its tracks. But we've improved and learned so much more. We've been able to develop apps such as the auto-visual AFP detection and response app. These are improvements over time that are being used now for COVID-19. These are the same skills and tools that we've been able to use to improve routine immunization. This is why we've surpassed historical expectations by more than doubling the coverage in routine immunization. So we will continue to use this to also crash down the number of women and children under 5 who are dying every day in Nigeria. For us at the National Primary Healthcare Development Agency, this is one of our priorities.
Okay. Since you've touched on women and children now, especially girls, the female folk, I want to take you up on the human papilloma virus vaccine. That could mitigate the instances of cervical cancer, especially when administered to young girls before they become sexually active. Are we making any progress in making that available for our, women?
Absolutely.
For our girls?
Absolutely. So one of the challenges to introducing any vaccine is indicating that when you introduce such a vaccine, that you have adequate coverage that will ensure that every child in Nigeria will be able to get it, to ensure equity. So because we've been able to improve routine immunization coverage, especially in the last 3 years, we are on course to be able to introduce human papilloma vaccines by the first quarter of 2021. That is massive, right? The only thing that can prevent that type of introduction is if there are global shortages in the vaccines. But for us in Nigeria, at the Federal Ministry of Health, at MPHCDA, we are ready to introduce the HPV vaccine by the first quarter of 2021. So we're all excited about that prospect, and we're hopeful that with that introduction, we'll be able to prevent, more women from cervical cancer.
Okay, with the eradication of polio, from our shores now, what sort of, continuous commitment do you expect? For instance, should there be a depth in funding or the sort of concerted efforts that we had seen previously? What do you expect?
No, we expect that we should have even more funding because by eradicating the white polio viruses, we've demonstrated the ability to effectively and efficiently, get rid of a disease. And using the same platforms, we'll be able to do even much more. This is why we're all excited and exhilarated by the Basic Healthcare Provision Fund. The Honorable Minister has just signed off for the funds to be disbursed through the gateways. That is an incredible infusion of funds into the primary healthcare space that will make it possible for primary healthcare centers that now look so dilapidated, right, to be renovated, to have the right kinds of human resources, to have solar, to have water. This is going to transform the primary healthcare space in the course of the next few years. It's been a long time coming, but finally it is here. Working with the private sector, we're optimistic that President Muhammad Buhari's vision for primary healthcare will now actually see the light of day. This is why, yes, we're excited about the white polio viruses, but we know that there's so much more that this administration has in the pipeline that is really going to excite Nigerians moving forward.
We look forward to that, Dr. Faisal Shuaib. Thank you so much for coming on Health Options.
Thank you very much for having me.
All right. A plethora of conditions ranging from obesity to anxiety appear to be linked to the microbes inside us. What are microbes? Let's now go over to our nature scanner, where integrative medicine expert Dr. John Tor Abide is standing by to throw more light on the topic.
Depending on where you were really trained, it could be pronounced as microbiome. And if you train in the UK, you can say that. But having been trained in America, it is actually known as microbiome. So, having said that, what is microbiome? Microbiomes are actually a community of microorganisms that you found in our gastrointestinal tract. That is from the mouth down to the opening end. Well, that is, the anus. So, so they are actually mostly bacteria. You have more than 60 trillion bacteria that actually are hosted in our gut. These bacteria, there are over 1,000 different, species. Their main job, they exist in a balance. That is the good and bad bacteria. However, there are certain things based on our lifestyle, our diet, the drugs that we take, they will deplete the population of these, microorganisms or bacteria that are mostly in our gut. If you know, this is the second generation. This is the next phase of which medicine is now looking at, diseases. Microbiome actually is responsible for generating 80% of our immune system in the gut. If you look at the immune system, gone are the days where we used to be told that the immune system, the centers are in the lymph nodes, in the spleen, and this. No, today 80% of our immune system is actually generated from the gut. There are a number of factors that can lead to the depletion of microbiome in our gut. if you're not taking the right diet, especially we should take diet that is high in grains, vegetables. This is what encourages or creates the right environment for the bacteria to coexist, both the good and the bad, bacteria. If we're taking a diet that is really not good, it actually affects, the numbers of these, bacteria. Medications. The type of medications that we take can directly affect these, microorganisms. Take, for example, antibiotics. Antibiotics actually kill the bacteria, especially the oral antibiotics. And this is why these days, any good treatment that is giving oral antibiotics, it is encouraged that it is accompanied by probiotics. Probiotics, this is a food that these microbacteria, they eat, and then they maintain a very viral and viable population. The probiotics, the food, other than the supplement, things like yogurt is really very good in probiotics. If you're taking antibiotics, and routinely in places like in the United States, they wouldn't be putting you on oral antibiotics for more than 3 to 5 days without giving you probiotics. It has to be given the food for the bacteria, so that as the bacteria depletes by the antibiotics, the probiotics helps them to regrow. So that is it. The kind of food is also very important because it affects the assimilation of some of the micronutrients in the gut. How do we then really overcome all these problems so that there is that symbiotic relationship that it is maintained? That is, that the population of microorganisms in our gut is not affected. One, you have to ensure that exercise is really very important. Meditation is also very important. Certain type of meditation like yoga, they are really very important. They actually help in calming us down. There will not be a disbalance. It is that disbalance of the good bacteria and the bad bacteria that normally causes some of these conditions in our gut, including indigestions. The stomach is not able to move properly, and if the stomach is not being moved properly, this bacteria cannot multiply, leading to a condition known as dysbiosis. Dysbiosis simply means a disbalance between the good and then the bad bacteria. This is what detoxification comes in, because the last end of the large intestine is the colon. And that is why you have impacted waste. And if the bacteria are not really functioning right, even to enhance and carry out further digestion, and then sending out of signals to the brain so that the brain can work fine, you see that it will eventually develop into colon cancer. Since we're talking about microbiome, this is the community of bacteria, which starts right from the mouth on, goes through our gastrointestinal tract to the anus. The number of bacteria in our mouth is more than that in our anus. And this is why a man's bite is more dangerous than that of from a dog. Or you can say, yeah, dog has rabies, which is very dangerous. Yeah, if it is rabies, but on average basis, the number of bacteria in our mouth is more than that in our anus. So habits, social habits, this is why we talk about lifestyle. Those people who go about engaging in kissing here and there, kissing everywhere, you know the danger that you are exposing yourself to.
We are not out of the woods yet, so stay safe and protect people around you from COVID-19 by adhering to all the safety protocols. A reminder also that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. I remain yours, Rabi Abdullah. Many thanks for watching. Hope to see you again.